When I was coming home, I checked the news and was so saddened and disheartened by the fact of what's currently going on in our country and the amount of cases that is very quickly rising in the Sunbelt states, in Texas and Florida and Arizona. And I just had this overwhelming sense of hopelessness. I thought back to the patients that I took care of and the COVID patients that I took care of, and one in particular stood out to me. This patient was diagnosed with COVID at the end of April. The patient was not able to stay home from work and had to go into work, and we think that's the reason why this patient contracted COVID, and unfortunately contracted a very severe form of COVID. The patient had to be intubated and be given the most advanced forms of life support. Fast forward 2 months, and this patient now was extubated, and for the first time during my time on service, we were able to, and we meaning the patient, myself, the medical team, the physical therapists, the nurses, we were able to support the patient to stand up for the first time in 2 months, and he was able to take his first steps. And those first steps are so symbolic because the patient's body literally went through hell and back, and the patient was able to recover. And I believe that if the patient is able to do that, and if the human body is able to recover from such a severe disease, surely we too can all take the first steps in whatever is going on in our country, in our world, around justice and racism, so that we can all move forward in this journey together and be stronger for it.